y'all. Welcome to the MHA panel series. This is our episode on accessing mental health resources. I'm joined by a couple of mental health professionals who have a lot of experience in the field and have some great input for us today. So first off, we have Chris Getz. She is an advanced treatment specialist and regional field manager at Acadia Healthcare. Acadia is the largest provider of behavioral health in the world. They hit as many boxes as they can, children, adolescent, veteran specific, gender specific. It's anywhere they can help, they do. We're really grateful to have her here. We also have Janie Stubblefield. She is an LPCS with her own practice, mobile counseling. She's got over 20 years of experience. She's very involved in the community, helps us out at MHA Dallas a lot. Has been a great influence, and we are very thankful to have her as well. So our first question is talking about the ways that behavioral health care and accessing it has changed during this time of physical isolation. So what's going on in the field? What steps are being taken?
Well, certainly within our facilities, they are giving daily updates on the COVID-19. They are stepping up their cleaning processes for sure. They are testing everyone. They're taking temperatures. They are practicing let's call it physical distancing rather than distancing. I liked how you verbed in the beginning. And they're actually doing live Zoom meetings on giving updates about how they're addressing COVID-19. A lot of my facilities across the board have said no to families flying in. Normally they have families fly in for Family Week. So as an extra precaution, they're saying no to that, but they are still doing the Family Week and family counseling via Zoom and via chat, FaceTime, whatever it takes, whatever they need to do. They're still giving the service, providing the service. They're just limiting the travel.
So one of the things that I have seen, and you know, the word we're using is pivot. One of the ways that I've seen mental health care pivot through this crisis has been through telehealth. At Mobile Counseling, we have offered telehealth services for 7 years. And so we have utilized that HIPAA compliant video component for a number of years. And so when our office became inaccessible and the governor declared a shelter in place, then we were able to very easily pivot to telehealth, to reach out to all of our clients and to say, you know, while traditionally we've been able to see you in our office or to make a home visit, that for your safety, for the safety of our staff, our services are going to be on telehealth for the time being. And 100% of our current clients have transitioned to that telehealth platform. Telehealth is a live video chat that you have with your professional counselor. It is an opportunity for you to see your counselor to see you, for you to have the same quality of service that you had when it was live, or not live, but when it was in person, because it is still live. And telehealth affords an opportunity for clients not to have a gap in services, but to be able to continue with the care that they were receiving. And so those restrictions don't exist if you have access to video and your counselor has access to video. And so we have great technology today that allows for telehealth to be as quality as an in-person counseling session.
Our second question is, what barriers are mental health professionals facing as far as providing care?
Well, one of the things we discussed today, especially as licensed therapists, I'm a licensed therapist, but a lot of them are trying to switch over to the telecounseling, teletherapy, but you actually have to be trained in that. Otherwise, you could be doing some things that are not HIPAA compliant, and so that's like a required thing. And so we are actually looking into maybe, talking with those therapists that we know are definitely HIPAA compliant and have had the training to actually utilize that. I think too, a lot of therapists are maybe not meeting with as many people because of this, or they're doing the Zoom, some Zoom groups. So at least we have access to Zoom or maybe, FaceTime. And I know, maybe not all licensed clinicians do that, but as far as people in the, that are healthcare providers, there are ways that we can, still reach out without being physically involved.
When it comes to telehealth, there are some very important protocols that need to be put in place. First of all, the platform that is used by the professional for the client should be HIPAA compliant. HIPAA is the Health Information Portability and Accessibility Act, and HIPAA is in place to protect an individual's personal health information. And so it's important that professionals use HIPAA compliant platforms. The platform we use is HIPAA compliant. It is encrypted, so their personal information is going to be protected. It is something that I can assure clients that confidentiality is still a very high priority. It is something that allows them to access services with confidence, just as much confidence as they would have if they were in person. And one of the other barriers that I see, however, is funding. One of the things that has come from our, both national and state leaders is that including telehealth and telebehavioral health specifically on the different third-party payers, that so medical insurance or behavioral health insurance would pay clinicians who would be able to provide professional counseling to their clients through this crisis. And so looking forward to seeing that some of those barriers may be lifted so that individuals can still access services that are very needed. For individuals struggling with depression or anxiety, this crisis has only exacerbated what they were already facing, and so it's very important that their care be able to have some fluidity and some continuity, and that there not be a gap just simply because of something that is outside all of our control. And so looking forward to like I said, our political leaders being able to bridge that gap so that the individuals and the clinicians can continue doing the work that they've been doing. Also, just for individuals who maybe haven't yet connected with a counselor, for them to know that they can, and to communicate that there's help available. You're not in this alone. There's people that you can talk to, and ways to be able to still access professional counseling services.
So our third question, there's got to be some, but what are the positive aspects of this kind of transition into a new form of care?
Well, we have to get creative, for one thing, but surprisingly, I have found an increase, there to be kind of an increase with people who are needing care or higher levels of care because their anxiety is shooting through the roof. And, people still need higher levels of care. People still need to go to residential treatment. Substance abuse doesn't stop just because of COVID-19. And so I've only had one person kind of raise a flag about, well, I'm just going to wait until some of this blows over. But other than that, I've not had anyone resist it. And so there are opportunities for us to do some things online. Look at our first responders. I've had some therapists reach out to me and say, hey, I'm doing some therapy dedicated just to them on Zoom. Can you connect me to your your first responder contacts. So a lot of people are getting very, I think, creative in how they can still address these needs and yet practice the physical distancing that we have been asked to maintain.
Mhm.
So one of the things that, as I'm meeting with my clients, as I ask, what's the silver lining here? And so part of the silver lining that I see is that we are able to see how resilient we are. And having professionals who are trained in mental health who can make the adjustment to a new platform like via telehealth to be able to continue to provide services to everybody in the public is a part of our resiliency. And one of the things that I think is important for mental health professionals to consider is the fact that culturally our society has been an online society for a number of years, and that's where people go to have social interaction. They utilize social media for community. They utilize social media to communicate, even their business. Lots of businesses use social media platforms to let people know what is available what in whatever industry they're in. And so I guess for me, part of the silver lining would be that the mental health community is now available through telebehavioral health on a large scale. And having that available ideally is going to break down some of the barriers that have existed, especially for people who are in communities that may not have a lot to offer in terms of mental health. I know in Texas, there are a dozen or so counties that don't have licensed professional counselors in the county. We have known for a number of years that we are in a mental health crisis. And so the silver lining I see is that professional counseling is available. It's available now. And you can go and you can find a counselor that has the specialization for what it is that you're needing services for, and you can get help today.
Absolutely. Not only is it out there, but people know that it's out there now and are
Right.
actively looking for it and accessing it. So I think that's
Exactly.
a huge benefit. All right, question number 4. I'm really curious, how do you think this is going to affect accessing behavioral health care in the future after all this time of physical isolation is over, things go back to normal? What's going to look different?
Well, that's a good question. I'm wondering if people may be more apt to make more phone calls if maybe instead of necessarily going through. That's a really good question. I've had some people reach out to me directly, especially in that they were people that reached out to you, Mental Health America. They may be trying to access these hubs, if you will, of resources more and more, as opposed to just getting on the internet per se. They may be looking for more of a resource that is able to give out a lot of resources as opposed to, say, just surfing the internet for a residential treatment center. Or they may be looking to people that they know to get referrals, people that they can trust. That's a really good question. I have to give a little more thought to it, but that's kind of what's coming to my mind just right away.
Yeah.
I think it's going to become more personalized.
Absolutely. And we know in the mental health field, especially, it's just there's so much out there, and a lot of times we're struggling when we're looking for this help ourselves, and even functioning on a day-to-day is difficult. And so it's very overwhelming. So maybe this is going to open people's eyes into what's out there and how do I access it. So it might be a challenge that we've needed to take as a society for a while.
My initial answer is I hope so. I hope that part of the ongoing silver lining of COVID-19 is that access to mental health care services becomes easy. That is a part of what mobile counseling, advocates all the time, is easy access to mental health care services. Breaking down barriers, making it easy for individuals to get the help that they need, erasing the stigma, letting people know that it's not, that you're not broken, that you're not a bad person because you've chosen to reach out and get help. I believe that those who reach out and get help are in some of the healthiest places they could be, because they understand that that we're not meant as created beings to live in isolation. And while COVID-19 has sent us into isolation, I'm thankful that there's technology that exists that allows mental health professionals to be able to be accessed by individuals who want that service. And so I hope that we do make this shift, that telebehavioral health becomes a norm, that it becomes just kind of a natural step to how we choose to then take care of ourselves and our families.
Yeah. And I love the point you made in the previous question about how there's rural counties that don't even have a LPC, and I think this is a great way to expand the care to those areas and reach people who have never been able to be reached before. I'm pretty excited about it. I think it's going to go really well. Our last question. Say that I'm looking for mental health services right now, this time. I need it. Where do I start? Where do I go? Who do I talk to? Do you have any tips on accessing care?
Well, again, I think people such as yourself, Mental Health America, you have a lot of resources within your own organization. I know that Acadia hired me and people like me across the nation to be sort of a one-stop shop. The assumption is that with 584 facilities that we have worldwide, that we would be that, quote, one-stop shop. But the truth of the matter is, our role is to find the best fit clinically, geographically, and financially. And so oftentimes I do and will refer outside of my family. So, for example, if you're, maybe you have Medicaid or Medicare, and so a lot of my facilities don't take that. So I need to go outside of my family to find those resources. Certainly, I also have to provide wraparound supports. So when the people come back into this area, from the facilities, maybe they didn't come from a therapist, or maybe they didn't have a psychiatrist, so they're needing partial hospitalization programs, intensive outpatient programs, therapists, psychiatrists. So it's my role to refer them out to those resources too. But if you didn't have someone like me, you can certainly go to maybe some of your hospitals and ask them if they have any resources that they like to refer out to. Trying to find larger entities, again, such as myself or in Mental Health America, hospitals, looking at partial hospitalization programs, intensive outpatient programs, because they'll be able to refer out back out into the community as well, or they will know some people. And so I think, again, having those personal relationships, but also maybe going to the larger providers to get some of these resources. I mean, you can certainly, call me on my work number, just as an example.
So I always say start where you are. And if they're watching this, perhaps they have some kind of knowledge about Mental Health America, and so reach out to Mental Health America and they can begin to help you with identifying who might be a good fit for you. Mobile counseling is available. If you want to reach out to us, we want to be a resource to you. And so just give us a call directly or go on our website. We're happy to see how we can connect you with the services you're needing. And in terms of tips, one of the things that I have advocated for many, many years is some clarity in terms of what kind of that alphabet soup behind everybody's name is. And so my tips would be, make sure you are working with a licensed professional. And there are a few different categories of that. I am an LPC, which is a licensed professional counselor and board approved supervisor. If you have children who are needing services, your children need to be with a play therapist. And the Association for Play Therapy has the whole registry of individuals who are registered play therapists. And again, making sure that they have the license and the registration, because those individuals are then accountable to a governing body like the state board or the play therapy board. And so you want individuals who've had very specific training in an area where you have a need. And so that would be my tip, is vetting out, making sure that the professional that you're connecting with has training and licensure and registration, that so that you know that they're accountable on the professional side, and you can just trust that the services that you're receiving are going to be what's best for you. The other tip that I would say is think of yourself on the consumer side, that this is your counseling. And so it needs to be about you and what your needs are. And I would say never, ever be afraid to make a change if you don't feel like you're getting the service you're needing. And so ask the questions, connect with the person, and then, trust the relationship, go through that therapeutic process, and trust that that professional is going to guide you through that process and work that treatment plan with you and help you get to the area, to the, whatever that is for you, for it to be successful. So
Absolutely.
there's help. So come get help.
Yeah. I'd like to add that it's out there, and the actual act of seeking help is impressive in itself. Anyone who's doing that should be proud.
Yes.
When I sought help for the first time, I met with a counselor who I knew I didn't connect with, that wasn't going to be my counselor of the future, but she did make me realize where I was at, what I needed. Ended up checking into inpatient care, and it's been up ever since. So just the start of that journey was just reaching out and finding someone, and they're out there. We have 2 professionals here who love to help, and they're all over the community. But again, just proud of anyone who's seeking help, and it's good. We're here for you, and you are loved. Okay, well, that is all we have today. Thank you so much for tuning in. Look forward to our next discussion coming out this Thursday. Until then, subscribe, and thank you for coming.